dentists, we have pediatric dentists, we have orthodontists, we have prosthodontists. I'm speaking big English this morning. We have periodontists, we have conservative dentists, we have endodontists, we have oral pathologists, we have oral medicine physicians. So dentistry has a lot of specialties. So today we are diving into one of the specialties, orthodontists. With me in the house, he is a consultant orthodontist. When your teeth is scattered, when one is going to Owerri and the other one is standing at Abuja, and maybe one is even in Canada, see, this man, those in his specialties, they can bring all the teeth together, and before you know it, everything is on a roll, well aligned. That's what the orthodontist, that's what they do. So join me to welcome to the house this morning Dr. Kosoko, consultant orthodontist. He is from University College Hospital. Dr. K.
Thank you very much.
You're welcome.
It's a pleasure being in this program this morning. I welcome everybody at home and parents, children, guardians, everybody. You are very much welcome.
Thank you so much for honoring the invitation. I can see you are loaded. You're coming out alone. Shows that this man is coming to give us stuff. Ẹ̀yin èèyàn wá nulẹ̀, adúpẹ́ lọ́wọ́ Ọlọ́run. Ọjọ́ ìṣẹ́gun mi lè ní. A máa ṣẹ́gun ní gbogbo ọ̀nà wa. Nílé, lóko, lọ́nà ọjà. Èmi ọ̀rẹ́ yín, èmi ọmọ yín ni mo tún ti wá lónìí o. Lórí ètò ìlera ẹnu pẹ̀lú ọmọ yín, ọ̀rẹ́ yín, àbúrò yín àtàtà, Adesola Odofin. Mo ti rí pé ẹ ti rí pé mo mú àlejò wọlé lónìí. Bí mo ṣe sọ fún wa rí, bí n bá tiẹ̀ sọ rí, mo tún fẹ́ sọ lónìí. Ṣé rí ọ̀rọ̀ ètò ìlera ẹnu yẹn? Àwa dókítà tá à ń ṣe ìtọ́jú ẹnu. Kì í ṣe pé ká máa yọ eyín nìkan la mọ̀ ọ́n ṣe o. A ní ìpele nínú ìtọ́jú ẹnu àti eyín. Àwọn tó jẹ́ pé iṣẹ́ tiwọn ni kó máa tò eyín wà. Àwọn tó jẹ́ pé iṣẹ́ tiwọn ní pé ókè o, eyín ṣe rántí pé lọ́sẹ̀ tó kọjá ń ta sọ̀rọ̀ lé lórí pé tí eyín bá yọ kí ni ọ̀nà àbáyọ ìtọ́jú rẹ̀. Àwọn kan wà ń táwọn ń ṣe nìyẹn. Tí eyín bá ní ihò àbí bóyá eyín nǹkan kan ti ṣe eyín yẹn ṣùgbọ́n tí a fẹ́ yọ, ọ̀tọ̀ làwọn tó máa ṣe ìtọ́jú yẹn o. Nítorí náà nínú yàrá pọ̀ gan-an ni nínú ilé àwọn dókítà tí ń ṣe ìtọ́jú eyín àti ẹnu. Lónìí, èèyàn pàtàkì tí mo gbé wá, ohun táwọn ń ṣe ni kó máa tò eyín. Gbogbo eyín tó ṣe kátàkátà, tó ṣe kótókòtó, tó rìn tó dúró bó ṣe wù wọ́n, iṣẹ́ tí wọ́n ní kó máa tò. Ẹ pẹ̀lú mi, ẹ jẹ́ ká jọ kí dókítà àgbà Dr. Kosoko. Iṣẹ́ títí wọ́n ní pé kó máa tò eyín. Dr. Kosoko, ẹ káàbọ̀ sórí ètò yìí o.
Ẹ ṣé gan ni ma. Àtọkùn, ẹ ṣé ẹ̀yin èèyàn wa nílé lóko. Mo wà inú mi dùn láti wà ní àárín nínú program yẹn ní òwúrọ̀ yìí àti láti lè bá wa sọ̀rọ̀ àti láti lè gbọ́ gbogbo question bàbá ní. Àwọn ìdílé ìfẹ́ máa enjoy ara ẹ̀. Ẹ ṣé gan.
Okay. Let's dive into it straight up. So I would like you to kindly, one after the other, can you actually tell us why some people have well-set teeth and why some people, their teeth decided to just go anyhow, you do anyhow, come stand anyhow? As in, what are the causes of scattered teeth, if I should put it that way?
Thank you very much. So, maybe I should start by talking about what exactly is malocclusion before we talk about the causes of malocclusion.
Malocclusion is scattered teeth.
Scattered teeth.
Don't use too technical.
So scattered teeth. When you look at teeth, there are some people, especially when you look at the magazines and some of the advertorials that we watch, you see people that does those advertorials, the way they present their teeth, they are well arranged and well arranged. That some of us will say, can anybody's teeth be this good? Yes, yes, people's teeth can be that good. When you look on the other side and check other people, especially those of you at home, when you look into your mirror and check your teeth, you see the way the arrangement of your teeth is. When it is not well arranged, as good as it's supposed to appear, especially for people, even when you look at a straight, you will know it. But once it's not well arranged, you will know that something is wrong with the arrangement of this. So any category of teeth that fall into a position or a state that is different from a well-arranged teeth is referred to as a scattered teeth. And that scattered teeth means a lot. Scattering teeth, represents a lot of things. These are the things we're going to be discussing so much more about today. So, coming over to that, we come to what are the causes of these scattered teeth. Along the line, I'll be telling you some of those scattered teeth in line with what causes it. First and foremost, I will say that scattered teeth causes are broadly classified into 4 different groups. Number 1 is the skeletal factor. Number 2 is the soft tissue factor. Number 3 is the local factor. And number 4 is habit.
Okay. The English my Oga has spoken is that different things can cause these scattered teeth. It could be bony factor. That's what he means by the skeletal. It could be the bone. There are bones in the structure, in the facial structures. Bones form the like the framework. The foundation on which the tissues, that's the flesh, are laid on. So it could be a factor of the bones or the soft tissue, the flesh on the bone. And the local factor, don't worry, I'll help you break it. The local factor is those things, the village people surrounding the teeth. Okay, so let's go on.
Okay, good.
Yes, sir.
I will try as much as well to be breaking it down.
Let's take it one by one.
Okay.
Do one and go into the Yoruba part of it. And yeah.
So, talking about the bony factor.
Okay.
That is the causes that are related to the bones of the face. And not just the bone of the face, but the bone of the jaws. When you look at your teeth has upper teeth and you have lower teeth. And these upper and lower teeth are sitting on something. If you touch it, you will feel it, a bone. We call that jaws. We call it the jaws. So that constitutes the foundation upon which our upper and lower teeth are placed. Now, looking at that, are you getting it? Before, the major cause of that bony, discrepancy or bony misalignment is simply because of what we call genetics, what we call inherited,
what your parents gave you.
What your parents gave you. When you look at a child and you look at the parents, truly, this is the son of this baba or this man, or this is the daughter of this particular man. Why? Because there's a level of resemblance. Because facial resemblance, maybe height, maybe color, complexion, and things like that. So the same as it is in other parts of the body, so is also the bone of the face. Okay. The way the bone of your face or parent are is also the way you inherited some traits or some things from that particular aspect. But that's why when we look at a child and we look at the father or the mother, we say, this child is most likely going to have a bigger jaw or a smaller jaw. And when we look at this jaw, we look at the fact that the upper jaw that is carrying the upper teeth must grow in the same rate as the lower jaw. Now, once the growth of the upper is more than that of the lower jaw, we have a problem. Once the other way can be the growth of the lower that is more than that of the upper, then we have a problem. That's why we look at people that has a growth of the upper jaw that is much more than that of the lower. Their teeth will be shooting out. That is the common language of everybody. Say, my teeth is shooting. My son's teeth is shooting out. They will be shooting out in such a way that it becomes difficult for that individual to close the lip. When they want to close the lip, it becomes difficult. Now, some of our parents, they used to punish their child unnecessarily.
Cover your mouth.
Cover your mouth. They'll be beating her. It's not the fault of the child. It's not the fault of the child. It's just the way what we have given to the child that is being reflected. So we should first flog the parent before we start flogging the child.
For allowing the child to inherit such. So you are actually part of your parents.
Yes. So the basic thing is that don't just beat that child. Bring the child and let's find out how we can help the child to correct some of those things you as parents you don't like in the way your children appear because of the growth of the bone.
So, in summary, what my Oga has said, your teeth are sitting inside the bone, the upper and the lower bone. And they must go as friends in growth together, like I said of twins. So once the growth of one is ahead of the other, then there is a problem. If the upper jaw, that's the maxilla, is doing overstabi and say, Nami big pass you, grow ahead of the mandible, then there's going to be a problem. And if it's the mandible that is like ahead too in growth, so there is a problem. But basically what you have established to us is that the growth and whatever pattern the growth takes depends on what we inherited from our parents.
Yes.
Thank you for that. Can we allow our Yoruba people to... So, ohun tí a ti kọ́kọ́ sọ, mo ti béèrè lọ́wọ́ àlejò mi. Ṣé ẹ gbàgbé mo ní iṣẹ́ tí àwọn máa ń to eyín ni. Kí eyín yẹn yàwọ́, kíkan lọ ọ̀nà ìlú òyìnbó, kíkan wà Nàìjíríà. Àwọn ọmọ bó ṣe máa ń bóyá wọ́n máa ń fi òpèpè padà ní iṣẹ́ tí wọ́n ṣáà ní. So, ohun tí a kọ́kọ́ fẹ́ gbé yẹ̀wò ni pé kí ni àwọn nǹkan tó ń ṣokùnfà kí eyín rí kàtàkàtà.
So gẹ́gẹ́ bá a ṣe ti sọ lédè òyìnbó òun náà ni pé àwọn àgbọ̀n wa àwọn eyín wa wọ́n jókòó lórí àgbọ̀n bóyá àgbọ̀n tó wà lókè ni àbá àgbọ̀n tó wà nísàlẹ̀. Now àwọn àgbọ̀n yẹn ó ní bí gbogbo ara bó ṣe ń develop bó ṣe ń dàgbà bẹ́ẹ̀ náà ni àwọn àgbọ̀n yẹn náà ń dàgbà but wọn ò gbúdọ̀ dàgbà jura wọn lọ, wọn ò dẹ̀ gbúdọ̀ ìkan gbúdọ̀ máa dàgbà ju ìkejì lọ, wọ́n gbúdọ̀ máa lọ ní ṣíṣẹ̀ntẹ̀lé so that kò ní sí kánjọ máa ṣe wọ́n bí twins ni àwọn ìbejì ti tòkè àti ìsàlẹ̀ wọ́n gbúdọ̀ lọ, ìkan gbúdọ̀ ga jù kan lọ, ìkan gbúdọ̀ kúrú jù kan lọ, but tó bá ti ga jù kan lọ ó máa ti show á ti farahàn ní bí the appearance ẹni yẹn bá máa rí ẹlòmíì àgbọ̀n wájú tòkè ó súnmọ́ wájú ju tìsàlẹ̀ lọ, ẹlòmíì tìsàlẹ̀ ó súnmọ́ wájú ju ti tòkè lọ, and because of the kò ní jẹ́ kí appearance kò ní jẹ́ èèyàn ní like ẹlòmíì parents mi ò like mi like bí mo ṣe rí ẹlòmíì tẹ̀ ti gba kámú even at the level of adult I say well kò sí nǹkan tí mo lè ṣe sí nǹkan tọ́lọ́run fún wa nìyẹn but things can be done a lè ṣe nǹkan kan sí láti correct ẹ̀ torí pé ẹni ẹ̀ dẹ̀ máa wà ó máa like appearance ẹ̀ dáadáa.
So ohun tí wọ́n ti ṣe láyàyè àgbọ̀n yẹn wọ́n gbọ́dọ̀ máa jọ lọ bí ìbejì tí kan bá ti àparò kan ń ga ju àparò kejì lọ àfẹ́ tó bá gun orí ebè tí kan bá ti lọ sọ pé òun ò ga jù ọ lọ wàhálà bá ṣe kí ni wàhálà bá dé. Ẹ jẹ́ ká sáré ṣẹ́tọ́mu náà ẹ jẹ́ ń fún wọn lómi mu ká tó máa tẹ̀síwájú. Ẹ ṣé.
Hi, let me tell you my love story. I met this very handsome dude. He was everything I've always wanted in a man. 6 packs, tall, handsome and rich, but he had very bad mouth odor. I was almost giving up when I shared my worries with my friend, a dentist. She told me there's a remedy to bad breath. Not just bad breath, but also cavities, gum diseases, cracked or broken teeth, sensitive teeth, periodontitis, and several other oral problems. However, she strongly advised that we brush our mouth twice daily, after breakfast in the morning and before sleeping at night. She also told me that we should make it a priority to visit our dentist for dental checkup at least twice in a year. We should limit our sugar consumption and not wait till we have oral issues before visiting a dentist. So I shared this with my man, and today he is my husband.
This message is from Nigerian Dental Association and Medical Women Association, Oyo State Chapter.
lè ṣẹ́gun àrùn gbogbo.
Ìmọ́tótó borí àrùn mọ́lẹ̀ bí ọyẹ́ ti borí ooru. Ìmọ́tótó àti ìtọ́jú ẹnu wa ṣe pàtàkì púpọ̀ láti jàjàbọ́ kúrò lọ́wọ́ onírúurú kòkòrò ẹnu. Gẹ́gẹ́ bẹ́ẹ̀ ṣe mọ̀ wípé ẹnu ni ojú òpó tó lọ sí gbogbo ara. Ìdí rèé tẹnu fi gbọ́dọ̀ wà ní ìlera pípé. Ká kọ́ bí a ṣe ń tọ́jú ẹnu wa láti dènà àwọn àìsàn ẹnu lónírúurú. Ká sọ̀rọ̀ kẹ́nu bùtì kúrò lọ́rọ̀ rẹ nígbà tó o bá ti kàn sí àwọn akọ́ṣẹ́mọṣẹ́ tó mọ̀ nípa ìtọ́jú ẹnu. Ilé ìwòsàn ìtọ́jú ẹnu àwọn akọ́ṣẹ́mọṣẹ́ tó ní àmì ìdánimọ̀ fún àyẹ̀wò tàbí ìtọ́jú. Kàn sí àwọn akọ́ṣẹ́mọṣẹ́ olùtọ́jú ẹnu láwọn ilé ìwòsàn ìtọ́jú ẹnu tó forúkọ sílẹ̀ lábẹ́ ìlànà tó tọ́ tí ó ṣe ìtọ́jú tó lákàkì láì fún wa ní àkóbá kankan. Irúfẹ́ ilé ìwòsàn ìtọ́jú ẹnu tó forúkọ sílẹ̀ ní àmì ìdánimọ̀ tí àgbáríjọpọ̀ ẹgbẹ́ olùtọ́jú ẹni nílẹ̀ yìí buwọ́lù. Alága ẹgbẹ́ sì jọyìn sí pẹ̀lú. Ìkéde yìí wá láti fi sọrí àyájọ́ ìlera ẹnu lágbàáyé World Oral Health Day tí Association of Private Dental Practitioners of Nigeria Ọ̀yọ́ State ṣagbátẹrù rẹ̀. Ṣètọ́jú ẹnu rẹ kó o bọ́ lọ́wọ́ onírúurú àìlera ẹnu.
Yes, if you have been following us, I have a guest in the house, an orthodontist. We have been talking about the causes of scattered teeth, malocclusion, causes of malocclusion. You know, do you know why I decided to bring this topic? It's because I realized that a lot of our children and young adults that do not have good occlusion, it affects their psyche. Yeah. It affects their self-esteem. Yeah. And an experience I had with a young lady keeps reverberating in my mind. You know, they can't talk in public, they can't relate well because they feel they are not complete. So, and this can really affect what becomes of such a child, you know, and it can affect how effective and how far that child can go in life. That's why we've decided to talk about this today, so that our people can know that there is a solution to these things, and let them know that, okay, these are the things I'm sure as we're talking about the causes, some parents will be like, oh, really? Yes. This is what is actually happening. They can relate. So this is to let them know that there is hope. It can be treated, it can be managed. So I think you should go on, and as we talk about more causes of the scattered teeth.
Okay, thank you very much. Just in line with what you have said, I have treated some patients that told me that go and look through my phone, all my pictures. I don't smile.
Wow.
Because of the appearance of their teeth.
Imagine. So what's smiling? Smiling is good. It helps you to
free of charge for everybody.
Free of charge.
But some people, they cannot consciously. They can't smile just because of the appearance of that. So it's a major condition in the society that is really a big problem. People doesn't know that there are solutions to some of these things. Okay, going back, the second point that I mentioned, that's the soft tissue causes of malocclusion or scattered teeth. Let me use that word. Okay, now when you look at our mouth, we've talked about the teeth resting on the foundation of what we call the bone.
The bones, yeah.
Then we talk about what are the soft tissues that surround the tooth. We talk about the gum, we talk about the lip, we talk about the cheek, and we talk about the tongue. Now, all these things, they work together to establish a balance in the mouth.
Okay.
Now, if the activity of one of those muscles, I will give an example. When you look at your teeth is in between the tongue
and the lip,
tongue inside, and the lip and the cheek outside. And the force, the lip and the cheek, they exert force, the tongue also exert force. And where there is a balance of that force, that is where the teeth is well arranged. So when you have a situation whereby one of those muscles is more active than the other, I will give an example. Looking at the tongue, there are some people they do what we call tongue thrust.
Trusting.
They trust their tongue. And because they trust their tongue,
as in they push their tongue
forward outside. It has become a habit. So when they push it and continuously they do that every day, 24/7, in a whole year, 2 years, 3 years, before you know it, the arrangement of the teeth will be affected. And you find out that those kind of people have some problems they come with. Maybe their teeth are not closing together. That is, when they close their teeth together, there is space in between their teeth. And for that reason, there are some words they cannot pronounce. There are some There are some languages, they cannot say. It also affects function. Even talking, even eating becomes a problem, with those kind of people. So looking at that, is very important. These are some of the causes which, once we identify that, this is what is causing the reason for the scattered teeth in this individual, there are things we can do to help that individual to prevent the worsening of the case that is happening. Before I close on that, I want to mention another part which seems a little bit, another soft tissue.
Okay.
It seems a little bit away from the face, but it causes the problem also in the face.
Okay.
An example of that is what we call adenoid.
Oh, adenoid.
Adenoid enlargement.
Do we know adenoids? They are this structure at the throat.
Belu, they
call it
yes,
they call it belu in Yoruba. Those structures, when you open your mouth and do that's at the back.
So people that are children, normally everybody, that adenoid is enlarged. Are you getting it? But as you grow older, it's supposed to shrink.
Okay.
Are you getting it? But there are some people that, for whatever reason, that adenoid is not shrinking. And that adenoid is like the wall of the airway where we breathe in. That adenoid constitutes the floor of that place. Now, when it does not shrink as you are growing older, that means that when you are breathing in, there's not enough air going into your lungs.
Because that space is narrowed.
It's very narrowed because of that enlarged adenoid. And because it's narrowed, such an individual will be forced to always open the mouth, whether it's an adult or is a child,
to compensate
for the inflow of air. So that the amount of air that enough air that could not go in through the nose, the mouth, by opening it, can allow those air to come in, so that you don't have shortage of air. And by doing that, it alters the normal growth of the jaw of the face, as well as the teeth. So when they keep opening their mouth like that, you know that when you open your mouth, you will notice that there is a clearance between the upper and the lower teeth. When such an individual opens the mouth, when they are awake, they open the mouth. The posterior teeth, the one we call
that's the teeth at the back.
At the back, they begin to grow because there's no contact. They begin to grow. Nature doesn't leave a vacuum. So once you create a vacuum, they begin to grow to meet each other. By the time they meet each other at the back, then there's a permanent space in front, open in the front of the teeth. And such an individual cannot close the teeth. They say, I don't know what happened. My parents will say, my child used to close. I know the tooth is well set before, but now I don't know what happened. They can't close their teeth again. Those are the reasons why those things happen.
Awesome. So the soft tissue factor now, we've spoken about the adenoids. Who could have thought? God is awesome. As in, every part of the body just work together. to form, as in harmony, to make a perfect picture. So once there is an issue with one part, how would you have thought that the adenoid could affect, the teeth?
Definitely.
So the adenoid, a soft tissue at your throat, at the back of your throat there, affects the arrangement of the teeth.
Yeah.
So your lip, your tongue, the cheek, those are the soft tissue factor we're talking about. Ẹ jẹ́ ká tún tẹ̀síwájú. A ti sọ ipa tí àwọn egungun tó ń kó ìyẹn àgbọ̀n, tá a sọ pé inú wọn lẹ́yìn ń dúró sí. Ẹ ti sọ ṣáájú wípé àwọn ẹran tó tún wà lórí àwọn egungun yẹn, àwọn náà máa ń kó ipa. Ó yá, ẹ là wá lóye. Ipa wo ni àwọn ẹran tó wà ní ojú àti ẹnu tí wọ́n ń kó?
So talking to a Yoruba audience.
Ọmọ Yorùbá.
Yes. Àwọn ètè wa àti ahọ́n wa tí Ọlọ́run fún wa láti lè máa fi jẹun, láti lè máa fi sọ̀rọ̀. Àwọn náà wọ́n ń kó ipa nínú bí ẹyin ṣe tò sí ẹnu, bó ṣe tò sí ẹnu. So tẹ́ bá wo bí ẹyin wa ṣe tò yẹn, ahọ́n tó wà nínú àti ètè àti ẹ̀kẹ́ tó wà níta, gbogbo wọn ní force, wọ́n ní ìkópa tó ń kó nípa position àbí ipò tí ẹyin àbíbi tí ẹyin máa wà. Now tí ahọ́n tó bá ṣiṣẹ́ ju bó ṣe yẹ lọ, wọ́n máa ti àwọn ẹyin jáde. That's why máa rí àwọn kan tó jẹ́ pé wọ́n máa ń ti ahọ́n wọn jáde báyìí. Wọ́n máa ń ti ahọ́n wọn jáde níwájú. táwọn parents wọn sọ pé inú dé mama àti ahọ́n jáde irú àwọn nǹkan báyẹn is because àwọn ahọ́n yẹn wọ́n ń ṣiṣẹ́ ju bó ṣe yẹ lọ ni tẹ́ bá ti rí irú àwọn báyẹn they usually you always see ẹ máa ti rí pé àwọn ọmọ máa ṣe kí ni mo máa ti síta àwọn ẹlòmíì ètè ṣe rí àwọn irú àwọn tí wọ́n ti síta yẹn ó máa jẹ́ kẹ́yìn wọn tì síta ètè wọn tó wà níta kò ní lè tó máa ní kàn pé yín pẹ́ndé with all the gbogbo effort tó bá make wọn sì ní lè pa inú yẹn náà dé náà torí kí ni o torí pé ètè ahọ́n ó ń ṣiṣẹ́ ju bó ṣe yẹ kó ṣiṣẹ́ lọ torí bó ṣe ń ṣiṣẹ́ yẹn ó ti affect position ipò tí ó yẹ kí eyín yẹn wà so ìyẹn ó wà lára àwọn nǹkan tó ń fa kí àwọn eyín kó máa wà kó máa ṣe kébèkébé bó ṣe yẹ kó wà rìn lẹ́nu. Apart from that there is another thing tá a sọ nípa bèlúbèlú bèlúbèlú wà lọ́nà ọ̀fun and ọ̀nà ọ̀fun níbi tí a máa ń gbà láti jẹ́ kí atẹ́gùn èémí kó máa gbà wọlé so ìgbà míì normally bèlúbèlú yìí inú everybody gbogbo wa pátápátá la ní ṣẹ́rí tọmọdé bá ń dàgbà àwọn bèlúbèlú yẹn máa ń tóbi but wọ́n ṣe ń dàgbà sí bèlúbèlú yẹn ó máa shrink ó máa báwo la ṣe máa pè ó máa súnkì tó máa súnkì tó a level tó yẹ pé kò ní cause any problem but fún àwọn ọmọdé kan wà even táwọn àgbàlagbà tó jẹ́ pé bèlúbèlú yẹn ó máa instead kó súnkì kò ní súnkì ó sì máa tóbi náà bá dẹ̀ ṣe tóbi yẹn èémí ó máa affect bí èémí ṣe ń wọlé kò ní jẹ́ kí èémí lè máa wọlé dáadáa láti gba ihò mú wọlé àyè yẹn torí pé ó tóbi àyè yẹn ó ti kéré so torí pé ó kéré yẹn ẹ mọ̀ pé kò sẹ́ni kankan tó lè wà láyé láì gbé èémí sínú and not just kó máa gbé èémí tó jẹ́ pé kọ́lé tó jẹ́ pé enough tó máa tó so because of that wọ́n máa wà forced láti máa la ẹnu wọn láti máa mí láti ẹnu because of the problem tó ṣẹlẹ̀ pẹ̀lú bèlúbèlú now tó bá ti ń mí láti ẹnu yẹn ó máa tún affect bí ẹnu àgbọ̀n àti àwọn eyín bí wọ́n ṣe ń dàgbà nínú ẹnu so bó ṣe affect tó bá ti affect ẹ̀ báyẹn that is why along the line tó bá ti grow for a particular period a máa rí pé eyín wọn máa bẹ̀rẹ̀ sí ó máa rí ṣégeṣége bó ṣe yẹ kó rí ìyẹn tí ò yẹ kó rí bẹ́ẹ̀ so gbogbo àwọn nǹkan báyìí ó wà lára àwọn nǹkan tó máa ń fa àwọn wàhálà tani then mo fẹ́ sọ náà àwọn tó bá sùn wọ́n máa ń hanrun gan irú bèlúbèlú ló máa ń fa wàhálà yẹn tó máa ń hanrun gan ẹlòmíì ìhanrun ẹ̀dẹ́ẹ̀dẹ́ of course gbogbo náà là ń hanrun but it's not kì í ṣe gbogbo ìgbà but àwọn kan wà tó jẹ́ pé títí wọn ó kọjá bẹ́ẹ̀ irú àwọn báyẹn they are candidate of this kind of problem tá à ń sọ ẹni tó bá ń hanrun gan tó jẹ́ ọmọdé tó jẹ́ àgbà ó lè jẹ́ pé bèlúbèlú ó ti ga tí ò súnkì sísúnkì tí ó dẹ̀ súnkì yẹn ó máa bẹ̀rẹ̀ sí affect bí àwọn egungun ojú egungun agbọ̀n wọn eyín everything ó máa affect ó dẹ̀ máa jẹ́ kí gbogbo kìíní yẹn kó dàrú.
ṣe mọ̀ pé mo rántí pé mo ṣe iṣẹ́ abẹ tán fi bá mi gé bèlúbèlú yẹn nígbà yẹn èmi náà máa ń hanrun gan ó máa ń kò ní jẹ́ kéèyàn lè mú èémí tó kò dẹ̀ sí èyàn ò lè yan nature jẹ báwo ló ṣe ń sọ yẹn ní Yorùbá so ẹ̀yin èèyàn wa ò lẹ ti gbọ́ yẹn o ètè àwọn ẹ̀kẹ́ bèlúbèlú lẹ́yìn ọ̀nà fún lọ́hùn gbogbo àwọn yẹn náà ní ipa tó ń kó so àwọn gan tún ń pakún pé bóyá eyín á dúró déédéé àbí eyín kò ní dúró déédéé mo fẹ́ ká tẹ̀síwájú ó dà pé tún sọ pé àwọn nǹkan kan wà mo fẹ́ ká lọ síbi habits ṣe ọ̀nà because ó súnmọ́ ó fara pẹ́ àwọn tẹ̀ sọ́tọ́ rẹ̀ àwọn àṣà tí ò da tí àwọn ọmọ ń ṣe tó lè fa kí eyín kó rí gàtàgàtà ẹ jẹ́ ká sọ̀rọ̀ nípa yẹn.
okay àwọn ọ̀dà nǹkan míì tó tún lè fa kí eyín kó rí gàtàgàtà òun ni àwọn àṣà tí àwọn ọmọdé tó máa ń ṣe in fact àwọn àgbàlagbà míì náà máa ń ṣe tí ó yẹ pé wọn gbà tó ń dàgbà kò sẹ́ni tó bá wọn wí ọ̀ tó lè bá wọn sọ̀rọ̀ láti fi sílẹ̀ irú àwọn àṣà bíi ká máa mú ká ẹlòmíì ìka ẹyọ kan báyìí ló máa mú, ẹlòmíì ìka méjì, ẹlòmíì
àwọn míì mú mẹ́rin
ló máa kó sẹ́nu. Wọ́n á dẹ̀ máa mú, wọ́n á máa mú léra gan. Ṣé rí the number of time, that's iye ìgbà tẹ́ni yẹn bá fi ń mú ka àti tó bá mú ka yẹn bó ṣe ń mú ní kíkankíkan ló máa jẹ́ ká ó ní bó ṣe máa ipa tó máa ń kó láti máa kọ́ káwọn eyín kọ́ máa ṣe kí ni kọ́ máa dàrú. Mo ti mention another àṣà, òun náà ní kán máa ti ahọ́n jáde. Ẹni tó bá ń ti ahọ́n jáde ó lè jẹ́ pé ó ń ti ahọ́n jáde gẹ́gẹ́ bí àṣà ni o, ó ń ti ahọ́n jáde gẹ́gẹ́ bí bèlúbèlú tí mo sọ lálákọ̀ọ́kọ́. Irú àwọn nǹkan báyẹn náà ó máa ń fa kí eyín máa dàrú. So these are ẹlòmíì ó lè má jẹ́ ìka wọn, ẹlòmíì ó lè jẹ́ ètè ló máa mú.
Kan tí mo fẹ́ sọ náà nìyẹn.
A máa mú ètè.
A fa ètè yẹn mọ́ra báyìí.
A máa gé ètè jẹ. Àwọn of course gba àwọn tó jẹ́ gẹ́gẹ́ bí òbí, àwọn àgbàlagbà tẹ́ bá ti ń rí láàrin àwọn ọmọdé, máa ń mètè mọ́, ẹlòmíì ó ti mọ́ra. Tẹ́ ẹ̀ bá tètè wá láti ká ṣe nǹkan lé lórí, irú ẹni yẹn ó ní bó ṣe máa affect, bó ṣe máa ní ipa, kó ipa tí ò dára lórí àwọn eyín tó wà nísàlẹ̀.
Àwọn míì gan máa ń mu ahọ́n.
Wọ́n máa ń mu ahọ́n, yes. Ẹlòmíì máa ń mu, apart from pé wọ́n ti ahọ́n jáde, wọ́n máa ń mu ahọ́n. Tẹ́ bá ti gbé, wọ́n máa pẹnu dé báyìí, tó bá ti ń mu ahọ́n, ẹ ti máa rí lé bí tí wọ́n ṣe máa lọ sí, a ṣe máa lọ́nu, ẹ mọ̀ pé nìyí mu ahọ́n nìyẹn. Gbogbo àwọn kinní yẹn ó ní àwọn nǹkan tí ò da tó ń ṣe fún àwọn eyín àti fún àwọn àgbọ̀n. Ó máa affect, ó máa ń kó ipa tí ò dára nípa ìgbélọsókè, bí eyín ṣe máa dúró, wọ́n ṣe máa dúró, tó máa dúró sí lẹ́nu.
Even gan bí àwọn àgbọ̀n yẹn gan ṣe máa dàgbà sí.
Wọ́n ṣe máa dàgbà sí, ó máa affect ẹ̀.
Ṣé rí, mo rí ìrírí kan tó ṣe mí ní kàyéfì. Ó dẹ̀ ìyá yẹn ló ń ti ọwọ́ ọmọ ẹ̀ sí ẹnu pé kó máa mú ká. Mo wá pè pé
wàhálà ẹ̀ ti pọ̀ jù.
Kí ló dé tí òun ti ìka sí ẹnu ọmọ ẹ̀? Ó ní ṣé mi mọ̀ pé tó bá ń mú ká yẹn kò ní máa ké ń gbogbo ògbà. Mo ní tó bá mọ jàǹbá tí ìka mímu yẹn tó máa ṣe fún eyín ọmọ ẹ̀, tó bá mọ iye owó tó máa ná, tó bá mọ ohun tó máa fà fún ẹ, ò ní sọ pé kí ọmọ kó máa ṣe kí ni, kó máa mu ìka o. So lẹ́gbọ́n gbogbo àwa ìyá ọlọ́mọ, ẹ bá ti rí pọ́mọ yín mú ká, ẹ tètè yá gbà o. Torí kí ni ó ń bẹ yín jẹ́, ó ń jẹ́ kẹ́yìn ṣe kí ni kó rí gàtàgàtà. Ọmọ mi á máa mú ètè, ọmọ mi á máa mú ahọ́n. Tẹ́ bá ti rí irú ẹ̀, ẹ wò ẹ ṣáà bá mi ra ta ẹnu yẹn, n ti máa ń ṣe fúnru wọn nìyẹn. Irun ti máa ń ṣe fúnru wọn nìyẹn, ìrọ̀ra ṣe kí ni, ìrọ̀ra tá báyìí. A bá ti ta ẹnu yẹn tó bá kí ló mú àwọn fún, kí ló mú. Ẹ má sọ pé child abuse o. Ọ̀rọ̀ mi lè sọ pé child abuse ní í sìn, ṣùgbọ́n òun lẹ ti gbọ́ yẹn, gbogbo àwọn àṣà yẹn ká máa mú ká máa mú ètè, ká máa mú ahọ́n, gbogbo ẹ̀ ló ń ṣe kí ni, gbogbo ẹ̀ ló ń ṣe jàǹbá fún bí eyín ṣe máa dúró àti bí àwọn àgbọ̀n òkè àti ìsàlẹ̀ bọ́n ṣe máa dúró. Yes, I said we should also go into, you've spoken about the soft tissue, the effect of the lip, the tongue, and the cheek.
The cheek.
Yes, and even the adenoid.
Yes.
There is a factor close to it,
which is
that's
habits.
the oral habits.
Yes.
I want you to just talk about that oral habits.
Okay, like I've said, the oral habit is part of the factor that influences the scattered or the arrangement of the teeth. And we've mentioned and see that one of these common habits, which most of us have observed in some children, has something to do with digit sucking. We call it digit sucking. And with the digit sucking, they can suck any part of their finger. They can suck the thumb, they can suck the two middle finger, they can suck 4 fingers. Some children are like that. And some even had 2 hands they would put in their mouth and suck. And it's so terrible. As a parent, these are some of the things we need to be on the lookout for. Because along the line, it will affect the arrangement and the development of their face. And those kind of children, when they grow up, they will not be able to, relate well amongst their colleagues. Because it affects their psychology, it affects their self-esteem. It makes them withdraw to the closet. Socially, they're affected. And and the main role that we need to play as parents, there must be a balance of I love my children and the balance of when you need to discipline them, so that balance will give us a better and a stable individual for the society. Okay, so apart from sucking the tongue, the thumb, I have others that also suck their tongue. Apart from trusting the tongue, because trusting the tongue is part of the habits that people do. They also suck
the tongue.
The tongue. They suck the tongue. They suck as if they are sucking breast, or they are sucking what's this thing? Ice cream or anything. They suck those things, and at the long run, it has a negative effect in the development of the face. Apart from that, we have people that also bite their tongue. I mean, their lip.
Yeah.
They bite
chew their lip.
Bite their lip. Nail biting. A lot of us do that. It's another thing. Eating the biro's, what's it called?
The cover.
That's common amongst the students, especially when exam is a little bit tough. They start biting and say, maybe by biting,
maybe they will have a revelation.
So those things are habits that needs to stop. And we need to discourage it in our children, our growing children, and even teenagers as well as young adults. Very important. So some people they bite their lip. Some suck their lip. They suck the lip. They suck the lip. All these things, it causes a kind of disturbance in the normal growth of the face and the jaw and the teeth. And once it disturbs it, we call it an habit, not something you do once in 3 months. It's something you do every day. And you do for a long period of time, 1 year, 2 years, 3 years. If you don't stop, it's going to be a major, a cumulative effect, a major problem. So these are some of the things that parents need to look out for. And if you notice any child already doing that, and they are your kids, they are your wards, please, there are things that can be done at this time, especially when they are growing, that can probably arrest that habit and allow the body to readjust itself back to the normal way it's supposed to grow.
Thank you so much. I mentioned in Yoruba earlier that I once met a young mother who was actually trying to make the child suck the digit. I'm like, what are you doing? She was like, auntie, if this child sucks the thumb, it will reduce my stress. The child will not be crying every time. I said, you don't know what you are doing to yourself and to your child. So that's it. You've heard it. Thumb sucking, tongue thrusting, tongue sucking, lip sucking,
lip biting,
nail biting, biro chewing. All those habits you will pay a great price for them. So please, let's caution our children, especially those that are still under 5 or even under 15. Let's caution them, let's help them. And really, there are dental solutions to all these habits. We will talk about this. We will get there. So I think we should just go on a break. Let's, for a short period, then we'll come to the concluding parts.
Okay.
Let me tell you my love story. I met this very handsome dude. He was everything I've always wanted in a man. 6 packs, tall, handsome and rich, but he had very bad mouth odor. I was almost giving up when I shared my worries with my friend, a dentist. She told me there's a remedy to bad breath. Not just bad breath, but also cavities, gum diseases, cracked or broken teeth, sensitive teeth, periodontitis, and several other oral problems. However, she strongly advised that we brush our mouth twice daily, after breakfast in the morning and before sleeping at night. She also told me that we should make it a priority to visit our dentist for dental checkup at least twice in a year. We should limit our sugar consumption and not wait till we have oral issues before visiting a dentist. So I shared this with my man, and today he is my husband.
This message is from Nigerian Dental Association and Medical Women Association, Oyo State Chapter.
ìmọ́tótó borí àrùn mọ́lẹ̀ bí ọyẹ́ ti borí ooru. Ìmọ́tótó àti ìtọ́jú ẹnu wa ṣe pàtàkì púpọ̀ láti jàjàbọ́ kúrò lọ́wọ́ onírúurú kòkòrò ẹnu. Gẹ́gẹ́ bẹ́ẹ̀ ṣe mọ̀ wípé ẹnu ni ojú òpó tó lọ sí gbogbo ara. Ìdí rèé tẹnu fi gbọ́dọ̀ wà ní ìlera pípé. Ká kọ́ bí a ṣe ń tọ́jú ẹnu wa láti dènà àwọn àìsàn ẹnu lónírúurú. Ká sọ̀rọ̀ kẹnu bùtì kúrò lọ́rọ̀ rẹ nígbà tó o bá ti kàn sí àwọn akọ́ṣẹ́mọṣẹ́ tó mọ̀ nípa ìtọ́jú ẹnu. Ilé ìwòsàn ìtọ́jú ẹnu àwọn akọ́ṣẹ́mọṣẹ́ tó ní àmì ìdánimọ̀ fún àyẹ̀wò tàbí ìtọ́jú. Kàn sí àwọn akọ́ṣẹ́mọṣẹ́ olùtọ́jú ẹnu láwọn ilé ìwòsàn ìtọ́jú ẹnu tó forúkọ sílẹ̀ lábẹ́ ìlànà tó tọ́ tí yóò ṣe ìtọ́jú tó lákàkì láì fún wa ní àkóbá kankan. Irúfẹ́ ilé ìwòsàn ìtọ́jú ẹnu tó forúkọ sílẹ̀ ní àmì ìdánimọ̀ tí àgbáríjọpọ̀ ẹgbẹ́ olùtọ́jú ẹni nílẹ̀ yìí buwọ́lù. Alága ẹgbẹ́ sì jọyìn sí pẹ̀lú. Ìkéde yìí wá láti fi sọrí àyájọ́ ìlera ẹnu lágbàáyé World Oral Health Day tí Association of Private Dental Practitioners of Nigeria Ọ̀yọ́ State ṣagbátẹrù rẹ̀. Ṣètọ́jú ẹnu rẹ kó o bọ́ lọ́wọ́ onírúurú àìlera ẹnu.
For those who have stayed tuned, we have been talking about the causes of scattered teeth, causes of malocclusion. So we will enter the concluding part. It's still remaining one thing that you mentioned earlier. That can you kindly enlighten us?
Okay, the last one, which is apart from the within the broad category of what causes the scattered teeth, the last one is what we call the local factors. The local factors has to do with the factors that are very close to the mouth. The factors that are local, that are resident,
the
that
village
are close.
people.
Yes, my village people.
Village people.
So the village and the villagers around your mouth are the one causing this problem. They categorize that. Normally, everybody, as a child, you're supposed to have about 20 teeth in numbers.
Yes.
And an
as
adult,
a child?
yes, and an adult is supposed to have 32 teeth in the mouth.
Some of us don't have up to 32.
Yeah. But at least as an adult, you should have 28 minimum.
Yeah.
Maybe it's only the wisdom teeth that had yet to come out. Now, but there are some problems with the teeth, like the number of teeth that has a way of affecting the arrangement of the teeth.
Okay.
I'll give an example. For that 32, we may have others that have more than 32 teeth in their mouth, or more than 20 teeth for a children.
Yeah.
Are you getting it? We call that a supernumerary or extra teeth.
Yes,
So
I heard.
for those kind of people, you will notice that the space in their teeth, the space on the jaw is not enough for the arrangement of the teeth. And you notice that's why it's just like when you went to enter Molue in Lagos and everybody's rushing. So everybody, you enter anyhow, whether through head, through leg, through squeezing yourself,
through the window.
it doesn't matter.
Or
The issue is
the
that
boot.
just make sure you enter. So everybody, the teeth, we also want to you give me space now. And because of that, some of them will turn, some of them will not be able to, they will not be able to
Some
come
will
out
be
fully.
hanging.
Some they will even shank them. They won't have space at all. They will be totally out of the arrangement, the normal line that it's supposed to, to be. And this as a result of the fact that we have a lot of teeth in the mouth, and that can cause. We call that crowding in English. That's crowding. And apart from that, some people do not have more than they don't have up to the number of teeth. Number of teeth that is supposed to have. Instead of 32, some had less than that. Some of them, the teeth is so less, maybe up to just 20 something. Wow. That is in their mouth, and for that reason, there will be a lot of spaces because the jaw, the way God has factored the jaw is just that the jaw is just like the space, the room that is accommodating the arrangement of the teeth. So when you don't have enough teeth, there is enough room that is in the mouth, and as a result of that, you know that the teeth can begin to rotate. They can go haywire because when they are together and they are well arranged, they will just be standing shoulder to shoulder, and they will not allow each other to rotate or to form a wrong position. So that is for the first one. The other one is the shape of the teeth, the size of the teeth. There are some teeth. Normal teeth has normal sizes, especially for the different types of teeth that we have. But maybe I should mention along this line, because I've come in contact with parents who comes to the hospital to complain about the size of their teeth of the children.
Okay.
And I used to tell them some of the complaint they have is actually not a problem. It's just that, the child, by the time they are bringing out the adult teeth, they are bringing out the adult size teeth,
Yes.
which compared to the body of the child, it appears to be bigger. Because teeth does not grow in size as the body grows in size. The size that it has come out, as at the time it comes out, is the same size it will remain till God called that individual home. So, as at that time, there are some people's teeth that is big, is an adult size teeth, but is inside the mouth of a child. So they come out, it's too big, it's too big. The fact is that we just tell them, don't worry, it's not a problem.
Allow the boy to grow.
When the boy grows, it will be commensurate to one another. So that's one I'm just mentioning in passing is not a problem. Now, coming to the sizes. So there are some, these things that are big, there are some that are small. Some that are small, they just come like a nail, the way a nail is. There are some teeth like that. We usually call them the peg-shaped teeth.
Yes,
lateral teeth.
Peg-shape.
And once you have those ones, they have a way of affecting the aesthetics of the individual.
In pause on that. Next week we will continue, but summarize what you have just said in Yoruba.
Yeah. Kíákíá. Àwọn ẹyin mo ti sọ pé àwọn wàhálà kan máa ń wà fáwọn ẹyin tó jẹ́ pé inú ẹyin gangan ló ti máa ń wà. Àwọn gẹ́gẹ́ bí wọ́n ṣe sọ my village, àwọn aráàlú mi. Àwọn aráàlú mi. So a rí pé àwọn ẹyin kan wà tó jẹ́ pé wọ́n máa ń tóbi ju àwọn kan lọ. Àwọn ẹyin normally ẹyin ní bó ṣe yẹ kó tóbi tó, but àwọn ẹyin mi wọ́n máa ṣe kíni, wọ́n máa tóbi gan. Àwọn ẹyin mi wọ́n ní tóbi tó bó ṣe yẹ kán tó. Wọ́n dẹ̀ máa wà lẹ́nu oníkálukú. Irú àwọn ẹyin báyẹn ó ní bó ṣe máa affect bí ẹyin ṣe máa ń tò. Àwọn ẹyin tó bá tóbi jù kò ní sí àyè fún wọn. Apart from pé ẹyin tóbi jù, àwọn ẹyin ẹlòmíì wọ́n máa ń ní ẹyin number, what do you call that? Number. Àwọn
ẹyin wọ́n máa ń pèlé.
Ẹyin tó pọ̀ ju iye tó yẹ kán ní lọ. Irú àwọn ẹyin báyẹn ó máa ní bó ṣe máa affect. Àwọn ẹyin ò ní lè dúró dáadáa, wọ́n máa dúró sẹ́gbẹ̀ẹ́, wọ́n máa fúnra wọn ni. Wọ́n máa dẹ̀gbẹ́, ẹlòmíì máa dẹ̀gbẹ́, ẹlòmíì wọ́n tẹ̀ ti kúrò láàrin line. Kò ní sí lórí line rárá. Kò ní sí lórí ìlà. So irú àwọn ẹyin báyẹn ó ní àwọn nǹkan tá a lè ṣe sí, because gbogbo àwọn nǹkan táwọn èèyàn máa ń rí nínú ẹyin tó yẹ pé wọ́n máa ń fi wò pé ẹyin mi ò tó dáadáa, ẹyin mi yóò dáa, mi lè máa rẹ́rìn-ín, mi lè máa ṣe báyìí, mi lè máa sọ̀rọ̀ dáadáa. So gbogbo àwọn nǹkan báyìí ni àwọn nǹkan tá a máa ń ṣe.
Dr. Kòsọ́kọ́, a máa dúpẹ́ o, ọ̀rọ̀ wa ṣì pọ̀ o. Ẹ̀yin èèyàn wá nulẹ̀ òun lẹ ti rí ẹ̀wẹ̀ wò, ọ̀rọ̀ pọ̀ gan ni. You don't want to miss next week. We have not been able to, go through all we have for you. I want you to keep it a date. Next week, Tuesday, 11 a.m. to 12 noon. It's another time with me on this program. Dr. Kòsọ́kọ́ will do us the privilege of coming back to come and finish what he started. Ẹ̀yin èèyàn mi nulẹ̀, a lè parí ohun tá a gbé wá ká yín mọ́. Ṣé ti rí pé ẹ ní láti tún pàdé mi lọ́sẹ̀ tó ń bọ̀ pẹ̀lú Dr. Kòsọ́kọ́? Wọ́n máa tún wá pẹ̀lú ògo Ọlọ́run, kọ́lọ́run kó dá ẹ̀mí wa sí, kọ́lọ́run kó ṣọ́ pàdé wa, ká pàdé lọ́sẹ̀ tó ń bọ̀. Ẹ ṣé.
Primus Radio. Ojú ọ̀gbagadì láti fẹ̀fẹ̀ rẹ̀ hàn. Primus Radio. Ojú ọ̀gbagadì láti fẹ̀fẹ̀ rẹ̀ hàn. If you have a message, think Primus. If you have a gift, think Primus. If you have a dream, think Primus. Primus Radio. Express, exhibit, and explore.
When you talk about music,
girl, I know fit wait. Give me fire, make it blaze. Make it blaze.
Sport is show.
Oh my God, an insane goal! I've just seen the most insane goal I have ever seen on a football pitch.
Programs Nko e plenty news and current affairs. Everything is in one.
Primus Radio. Express, exhibit, and explore.
We give you the right tunes, the right vibe, all in one in all. It is Primus. It sparkles the world. Primus Radio.
pátápátá ọlá porogodo ìbà fún elédùà tó ṣẹ̀dá kó wa gbogbo. Mo kí ọkùnrin, mo kí obìnrin, mo kí ọmọdé àti àgbàlagbà. Mo júbà gbogbo àgbà pèdèpèdè tó ti ń pèdè kí n tó máa pèdè. Sórí wọ́n ní àdáṣe báyìí ní hun mọ ìbà kò gbọ́dọ̀ hun mọ. Ẹkú lébà ìlà ń kára lé, ẹkú àbọ̀ là ń kérò rìnà. Mo tún kí gbogbo ẹ̀yin olólùfẹ́ ìròyìn àsìkò fún ti ọ̀sán tòní, mo kí yín káàbọ̀. Gẹ́gẹ́ bí a ti mọ̀ wípé ìṣe wa ni láti mú ìròyìn àsìkò wá sí etí ìgbọ̀yín ní gbogbo ọjọ́ ajé, ìṣẹ́gun àti ọjọ́rú ní aago 12 sí aago 12:30. Iléeṣẹ́ ìgbóhùnsáfẹ́fẹ́ ta ti ń kàn sí náà ni Primus Radio, èyí tá a kalẹ̀ sí òpópónà Olúyọ̀lé Sharp Corner ìyẹn nílùú Ìbàdàn. Gẹ́gẹ́ bí a ti mọ̀ pé orúkọ ọmọ báyìí ni ìjánu ọmọ, orúkọ ọmọ yín ọ̀rẹ́ yín olólùfẹ́ yín tí ó máa mú ètò ìròyìn àsìkò wá sí etí ìgbọ̀nyín fún ti ọ̀sán tòní náà ni Christiana Ìpàdéọlá. Ẹ máa bá wa ká lọ. Ẹ tún káàbọ̀ padà fún ẹ̀yin tí ẹ ṣẹ̀ṣẹ̀ ń láǹfààní láti máa gbọ́ wa àbí ẹ̀yin tí ẹ ṣẹ̀ṣẹ̀ ń láǹfààní láti darapọ̀ mọ́ wa. Ẹ kàn sí wa lójú ìtàkùn àgbáyé wa lójú òpó ti ìbáraẹnisọ̀rọ̀ ìyẹn Facebook @Primus Media City. Ẹ darapọ̀ mọ́ wa, ẹ like, ẹ fi àtẹ̀jíṣẹ́ yín ránṣẹ́, ẹ share lóríṣiríṣi. Bákan náà ẹ tún lè wò wá, ẹ sì tún lè gbọ́ wa kétékété náà lórí YouTube page wa @Primus Television. Ibẹ̀ lẹ́ ó ti láǹfààní láti gbọ́ wa, tẹ́ ó sì máa wò wá kétékété.